Hello, today we're going to talk about knee pain because most of us would have been affected by knee pain at some point in our life. So I have a PowerPoint presentation here, knee pain and what you can do about it. So first of all, let's talk about the anatomy of the knee. We have the knee joint here. We have the femur on top, the tibia and fibula, the two bones below. The blue areas as the cartilage. And on top of the cartilage, we have an additional bit of cushioning in the knee. And this is called the meniscus. On the sides of the knee, you can see these ligaments. We call the medial and lateral collateral ligaments. And in front of the knee sits the kneecap. From behind the knee, we can see the actual cross ligaments, which are inside the knee to give additional stability. These are called the cruciate ligaments. And very importantly, from the side view, we can see how the kneecap is embedded in this tendon, this patellar tendon or the kneecap tendon, which inserts in the tibia just below the knee. And above that is the quadriceps muscle, and those tendons go around the kneecap. So a lot of things can give knee pain. It's not just the cartilage or arthritis. It can be the ligaments. It can be the muscle on top of the kneecap here. It can be where the tendon inserts into the bone over below the knee. It can be on the side, the ligaments. It can be where just below the ligament on the tibia or on the bone itself, there's a very painful spot there. That can be something called a bursitis, an anserine bursitis. So many things can give you pain. Behind the knee, sometimes we have a collection of fluid, and this is called a Baker's cyst. But if the calf of the muscle or if the leg itself is swollen and tender, we worry about blood clots. Now, on the side of the knee, we can see the kneecap, and this is a very, very important factor in causing many of the reasons for knee pain is due to the kneecap. So sometimes, often, the kneecap is lax, it moves from side to side, and when the knee is flexed or bent, the kneecap doesn't move smoothly in the femur. So the kneecap can move from side to side, and when people bend their knee or go up and down the stairs, they hear a clicking noise and a sort of feeling of pain. Sometimes the kneecap gets stuck out of position and it sort of locks the knee. It has to be very painful till it comes back. And all of this is because of a lax kneecap, very common problem. Now, we will be talking about that more, but because of the lax kneecap, additional problems can occur in the tendon below the knee and in the muscle above. Also here we have an additional look at the meniscus, which is the additional cartilage I spoke about. This can be torn either as part of a sports injury or sometimes due to wear and tear in the cartilage itself as we grow older. And this is an example of wear and tear. You see the blue area, the cartilage is getting worn off here. The cushioning between the bone is decreasing and the bones are coming closer together. So how do we treat all these things? Most of these things are treated, one, by physiotherapy with a variety of modalities, including TENS therapy, manual therapies, ultrasound. But the most important thing is exercises to strengthen the muscles around the knee. Warm and cold compresses, resting in injured knee, and short courses of anti-inflammatory or painkillers can be useful. These should not be used over long periods of time because anti-inflammatories can cause liver problems, stomach problems, and kidney problems. When exercising, it's best to avoid squats and lunges when the knee is injured or painful, and avoid high-impact exercises such as running, jumping, and skipping. But the strengthening exercises are the ones most important. And here we have this leg raising, which you can do when lying down in bed, and raising each leg slowly and bring it up and down. Now, it's not necessary to bring the leg all the way up, and it's sufficient to bring it up to 45 degrees this way and bring it down slowly. So I like to bring it up, have you bring it up and pause for a few seconds, count to 3, and then count to 3 here, and then bring it down again, count to 3 and bring it down again, and repeat on the other side. Now, this is the second exercise where you have a rolled towel placed under the knee and then squeeze the muscle of the knee and press down into the towel and bring your toe pointing towards your face. So this is how it's done. So you first press down and then you bring your leg towards yourself. Repeat on each side 10 times on each side. The next exercise is one of the most important according to me. You can buy an ankle weight. If you're very weak, this ankle weight should be about 1 kilo. And if you're stronger, it can be about 3 kilos even, a strong person. And you have to place it on your ankle and bring it up and down like this slowly. And when you bring it up, pause up there, pause up there, and then point your point your foot towards yourself again. So when you bring it up, pause and point towards yourself, and repeat this up and down, slowly, slowly, up and down, 10 times on each side. These are just simple stretching exercises which may be helpful. And you may not be able to bend your knee all the way. And if you can't, then don't stretch it like this. Don't strain the knee. And this is a simple hamstring stretch where you put your leg out in front and you can bend forward to get some of the stretching. So the strengthening with the weight on the ankle is one of the most important things because that can really help. Now, don't forget weight loss. Every 1 kilo you lose is 4 kg off the knee. And 80% of weight loss is through diet. So don't think you need to run a mile or 2 miles to lose weight, because exercise plays a smaller component in weight loss as compared to diet. Supplements such as glucosamine and chondroitin are really important. You can take 1,500 to 1,200 milligrams per day, a combination of both of them. They're made from the shells of shellfish, but vegetarian options are available. Vitamin D in doses of 50,000 once a week, because vitamin D is really important to strengthen the muscle of the thigh, and this helps to stabilize the knee. But do not take them if your vitamin D levels are normal. So take a short course for once a week for 8 to 12 weeks, and then follow it up with a maintenance dose of anywhere between 1,000 to 5,000 IU per day. Turmeric capsules have been shown in studies to be helpful for pain from the knee joint if it's due to non-inflammatory pain, not rheumatoid arthritis, for instance. And this non-inflammatory pain can respond to curcumin, 1,000 milligrams per day, along with piperine, which is a black pepper extract. Some people talk about collagen supplements. It's definitely good for the hair and skin, but I'm not very sure about the joints, but it may be helpful and no harm taking them. Joint injections, we sparingly use steroid injections only when there's swelling or inflammation in the knee, and steroid injections should not be used often because they can cause cartilage loss. Hyaluronic acid or these oily injections are a different kind of injection which cushions the knee. And then we also use a lot of platelet-rich plasma or stem cells. We have also published this review article on our experience in treating patients with rheumatoid arthritis and osteoarthritis. So what happens with PRP or platelet-rich plasma is your own blood is drawn out, it's centrifuged in the clinic, it's separated in here into red blood cell, white blood cell, and plasma. And the clear plasma you see here is taken out, and then that's directly injected into your knee. So it's your own body fluid going into your knee. And this body fluid has a lot of anti-inflammatory properties and regenerative properties. Stem cells also work well. Platelet-rich plasma definitely works better than hyaluronic acid and works better than steroid injections. And stem cells also work better than both of those. The stem cells can be removed from either your bone marrow in your hip or from just extracting it from fat around your abdomen. And it can either be injected directly after a little processing, or it can be expanded in a 2 to 3 process in a specialized lab where these millions of cells are expanded into even more millions of cells. And then you can have many doses which can be stored for you, and you can have many injections over a period of time. But it seems like even the SVF of the direct injection, which is less expensive, works as well. Before I end my talk, I want to talk to you about many people who none of these modalities work. The physiotherapy, the exercise, the supplements, these injections do not work, and they do need to go for knee replacement surgery. So do not be afraid of this surgery. If you need the surgery, it's fine, it's safe, the technology is great. Orthopedic doctors are very experienced in doing this. I'm happy to refer to my colleagues to do these surgeries when it's needed. So please do use it when you need it. So thank you for listening. Till the next talk. Bye-bye.